I guarantee that this will be the best and only tutorial you'll need to know how to use eye drops correctly. And stay towards the end of the video for Dr. Eye Guy's golden nuggets of wisdom to know how to use eye drops at a master level. Let's focus in. Hey, howdy everybody, I'm Dr. Neal Guymon, Dr. Eye Guy, with the tricks, tips, and tools to keep your eyes the healthiest and your vision the clearest. I do educational and review videos as well as how-to videos just like this one, so please subscribe for future Eye Guy videos. Also check below for my golden nugget recommendations. Otherwise, let's focus on how to use eye drops correctly. Now, eye drops are used for a lot of different things. If you have an infection, you're sometimes given an antibiotic, or if you have a lot of inflammation, you're given steroid eye drops. Also, there are a lot of dry eye drops for those people that have a dry eye condition. So chances are in your lifetime you may come across needing to use an eye drop, and that's what this tutorial is for, to guide you through step by step. Step number one is washing your hands really well. You will be touching in and around your eyes. You do not want to deal with an eye infection. Step number two is to make sure you check for an expiration date on the bottle or the box that it came in. The preservatives in the bottles will have a shelf life and can expire. Also, make sure that you know if you need to shake your bottle before you use it. Sometimes you need to shake it to mix the ingredients. Step number three is to unscrew the bottle cap, and I want you to make sure that you put the bottle cap somewhere that is clean. I usually get a clean tissue and place it on there. You don't want to put it on anything that's dirty or has goobers on it because you can contaminate the lid and then contaminate the bottle. Step number four, I want you to examine the tip of the bottle. If it has any yellow crusting or brown stuff on it, that usually means that it's contaminated, and you do not want to use that. You want to chuck that bottle, get a new one, start fresh. Step number five, you want to get ready to put the eye drop in. Sometimes it's easier if you get in front of a mirror so you can actually see yourself, or if you want to do the lying down position, that's going to work as well. Step number six, you're going to create the perfect area for this eye drop to go in. And what I mean by that is you're going to create a pocket, an eyelid pocket, for you to put that eye drop in to catch the eye drop. Now to do this, you need to get ready. You're going to use your dominant hand to actually hold the eye drop in, just so you have more control and better dexterity. With the other hand, your non-dominant hand, you're going to pull the lower eyelid down. Now there's two ways you can do this. You can form a fist and actually use your knuckles to pull that bottom eyelid down, or you can use your actual fingertips to grab that bottom eyelid to pull it down. Now a little tip here is where you're going to pull the eyelid. Sometimes people will grab on their bottom eyelid or near their cheek and they'll pull down, but it doesn't create a pocket that well. If you actually kind of pull closer to the eyelid margin or up higher on the eyelid and then pull from there, you'll get a lot more surface area where you can put that eye drop in, and it creates that pocket on that eyelid a lot easier. Step number seven, you're now ready to put the eye drop in. Important note here, when you're getting close to the eye with the bottle, you want to make sure you're not going to touch the eyelashes, the eyelid, or the eyeball. You might contaminate the bottle. Also, if you actually touch or rub on the eyeball, you might cause an abrasion or scratch your eyeball. Now when you have your non-dominant hand that's pulling the eyelid down, you can take your dominant hand with the bottle in it and actually rest on that non-dominant hand. This will serve as a base or a stabilizer for your hand, so you're not just waving in the air and trying to hit the target of your eyeball. That will actually act as a stabilizer, so you can hold still and actually get that drop in your eye. Now that you have the eyelid pocket and you have your eyes stabilized, you tilt your head back and you have that pocket ready. You squeeze the bottle just enough to squeeze one drop out, falls right in that pocket, and then you can close your eye. Now step number 8, once you have the eye drop in there, you want to keep your eye closed, and just to add extra punch or effectiveness to that eye drop, you're going to do what's called the punctal hold or the punctal block. Now there are small little drainage tubes right in the inside corner of our eyelids. That's where all of our tears are flushed down. And just to keep the eye drops on the surface of the eye, you can actually take your fingertip, any finger, and just push or hold right on the inner corner of the eyelids. And that will block or pinch off that drainage tube, allowing the drops to stay in your eye longer, getting more effectiveness from the drop. Now, a little tip here is when you put the eye drop in, try and keep your eyes closed for about 30 seconds. If you put the drop in and just start blinking and blinking away, you'll flush that drop out and sometimes actually push the drop off to the side of your eye. So if you put the drop in, keep your eyes closed for a little bit and also do that punctal hold, you'll get the best use out of that eye drop in your eye. Step number 9 is now you can finally put that clean cap back on the bottle and store it correctly. Check the instructions or check with your doctor to see how this needs to be stored. Some eye drops are better stored in the refrigerator. Now that you stayed towards the end of the video, it's time for Dr. Eye Guy's golden nuggets of wisdom to bring your eye drop use to the master level. Golden nugget number 1. If you happen to be using 2 different eye drops, you want to make sure that you use the first eye drop and then wait 5 to 10 minutes to use the second eye drop. If you use them right after each other, then they'll just wash each other out. Golden nugget number 2. Don't use eye drops while you're wearing contacts unless you were told to do so by your eye doctor. There are certain eye drops that have preservatives in them, and these preservatives can actually damage the contacts. Also, contact lenses can sometimes soak up the preservatives or the active ingredients in antibiotics or steroids, and it will be a constant contact on your eye and irritate the eye. Now, there are eye drops used for dry eyes that you can use for contacts, and if so, actually say on the bottle or on the box that they're safe to use for contacts. Golden nugget number 3. If you have a hard time actually squeezing the bottle to get the drop out, because some bottles are actually pretty stiff and can be pretty difficult to get that drop out, they make certain tools or instruments that you can use to help squeeze the bottle. I'll post some links down below so you can check those out on Amazon. Also, there's some other tools to help you get eye drops in your eye. Some of them are kind of weird looking and kind of funny, but I'll post the links below so you can check those out. Golden nugget number 4. If you're one of those people that flinch or even have a hard time keeping your eyes open, one little tip that you can do while you're getting used to the eye drops is try not to hold the eye drop really high from your eye. Number 1, that's going to make it hard for you to get the eye drop in your eyeball. But number 2, when it's really high up, that eye drop will almost feel like someone's doing a cannonball in the tears of your eye. And it'll be really jarring to the eye and it'll make you flinch even more. If you're able to do it a little bit closer without touching your eye, then that sudden drop on your eye won't be so jarring and it'll be a little bit more gentle. Golden nugget number 5. Now, if you're somebody that no matter what, your eyelids are clenching down, you cannot get your eyes open, it takes your family members to hold your arms down and to pry your eyelids open, then you might be one that would be best to actually close your eyes to put the drops in. Now, I'll have a video coming out about how to put drops in kids' eyes, and that's one of the techniques that we use is to have them close their eyes to put the eye drops in. Let me demonstrate that really quick. So you're going to want to lay down for this one and position your head in a way that it'll be able to catch the eye drop in the corner of your eye, the inside corner of the eye. So right between the nose and the eyelid. So when you close your eye, you want to try and aim that eye drop for that inner corner. Now for this one, you probably want to use 2 drops. You may go through eye drops a little bit faster, but when you have your eyes closed, you're going to put 2 drops in that corner, that nasal corner. And then the only tricky part is once you get the drops in there and you're able to keep the drops from flowing down your cheek because you're lying down, is you want to be able to try and blink or open your eye just a little bit and that drop will fall and slide right into your eye. Golden nugget number 6, you want to pay attention to the colors of the eye bottle cap or the tip of the eye bottle. A lot of different antibiotics and medications, glaucoma medications, steroids, dilation drops, they all have a color coordinated system going on. And so you want to pay attention to that. One color I'd pay specific attention to would be to see if your eye drop has a cap that's red or the eye tip is red. That means do not put it directly in your eye. A lot of the dilation eye drops will have a red cap to them. That means it's going to dilate your pupil. It will make your vision blurry for a little while. Also, there's a contact lens solution that has a red tip to it, meaning stop. Red means stop. Don't put it directly into your eye. That certain contact lens solution is made of hydrogen peroxide. If you put it directly into your eye, it will burn. Usually people that make this mistake only make this mistake once because it hurts. Okay, now that you've gone through Dr. Eye Guy's golden nuggets of wisdom, you should be able to use your eye drops at a master level. Now make sure to check my other videos where I have tutorials on how to use eye ointment correctly, as well as how to put eye drops in kids' eyes. If you got value out of this video, be sure to hit that like button for me, and if you have any comments or questions, I am here to help. Leave them down below. Again, I'm Dr. Neal Guymon, Dr. Eye Guy, looking out for you and your eyes. Stay focused, and I'll see you in the next